Now at 5:30, clearing up confusion about new mammogram guidelines and why local experts say more needs to be done.
Also, the new effort to fight food insecurity in and around Rochester, and how a Facebook post led to the arrest of a suspected rapist. Our top story at 5:30, how new mammogram guidelines are affecting the way women get screened for breast cancer.
We have advice from a local expert on when you should start breast cancer screening. 13 WHAM's Natalie Calzatoni spoke with an expert at Elizabeth Wende Breast Care and is back now with more. Natalie.
That's right. Good evening, Matt and Karen. It's National Women's Health Week, and a national health panel has released new guidelines recommending women start getting routine screening mammograms every 2 years, starting at age 40. Director of Genetic Counseling at Elizabeth Wende Breast Care, Jessica Salamone, says breast cancer affects 1 in every 8 women.
Sometimes cancer happens because of an environmental insult. We smoke or drink or behavior sort of related risk factors. And about 10% of breast cancer actually occurs because of a genetic mutation.
The United States Preventive Services Task Force recently released new breast cancer screening guidelines advising all women to get screened for breast cancer every other year from ages 40 through 74 years old. Salamone says breast cancer can affect women of any age.
The risk increases as we get older. So stopping at 74 may not be something that makes sense for everybody. It really should be something that extends beyond that point if a patient is able. And so a typical woman at a regular risk will begin mammogram at about age 40 and return annually after that. But somebody who is at a high risk because of a genetic mutation actually could begin that annual screening as young as age 25.
Salamone tells me there are preventative measures women can take to lower risk and catch breast cancer early, including genetic testing and cancer risk assessments. She says women over the age of 40 will have annual insurance coverage for a mammogram, and those with dense tissue will have coverage for an ultrasound. But people should discuss this with their insurance company. She urges people to not let fear get in the way of getting screened.
You're going to be afraid either way, but you're afraid in doing nothing or you're afraid in doing something. And when it comes to cancer and risk, doing something is key.